Next, we have CJ Robison, who is who's a health innovation scientist at Oracle Health's Global Business Unit.
Hello, everyone. Thank you so much for having me here today. Really excited that I get to be here. What a phenomenal day it has been. I'm CJ. I'm a registered nurse now, health innovation scientist at Oracle Health on their innovation team. Just to give a little bit of background on my team, the innovation team is this multidisciplinary team. I love them to death. We have easy access to experts from across the spectrum, from machine learning to genomics to immunologists to genetics, and then, the random clinical person like me thrown in there. So the reason I mention it is that, today we're talking about integrated diagnostics, and I think one of the big themes that has come out of today is the importance of this knowledge sharing and knowledge flows. And so having a team like that at Oracle that allows that sort of thing is phenomenal. But today what I really want to talk about is the EHR. So Oracle acquired Cerner back in June of last year, and that is how I ended up being here today. Well, actually, I really ended up here today because even from my first day as a nurse, I knew that the EHR system had to change. So let's talk about what needs to change now and what needs to change next. If I can't, watch me be the first person to not be able to figure out this thing. Big green button, thank you. Not the small red one. Yeah, got it. All right, so recently I've been talking to a colleague of mine, Dr. Kerr over at Boston Children's, about what are the needs that the EHR system has today? Because there's a lot of awesome technological advances, but the need of the clinician today is for these data visualization platforms. And I love talking to Dr. Kerr about this because he's created an app called Twist that sits on top of Cerner, and it stands for the way it should think. And what that means is that what we need today, the number one need we have, is we need to make it easy for folks to understand what's going on with their patient. Right now, it is hard. You even just think about how many clicks it takes for us to get to an image. That is infuriating, and that is time that clinicians do not have. And so when we think about the number one need, we need to think about making it easy for folks to have a comprehensive understanding of their patient at a glance. And so an example of this, in the context of today, a few folks have talked about longitudinal records, and for now, we'll just set aside whether or not we actually have true longitudinal records, even if you do have someone in the same health system from birth and on. But say you have access to a longitudinal record, even with access to that, you don't have a good sense of what has happened to my patient, how did the data elements correlate, and so you're left hunting and pecking through the chart to try to correlate different data elements, and that needs to change. The next big need we have is machine learning for workflow. So if data visualization is help me understand what's going on with my patient, machine learning for workflow is help me understand what to do. So in a recent survey, an example of this is in a recent survey, up to 71% of oncologists said that they wanted their patients to benefit from a genetic test, but only 11% of them ordered one. So machine learning for workflow says, hey, think about your patient qualifies. Think about ordering this test. Or what I get more excited thinking about is, say you have a patient who had a genetic test previously, and now new research has come out that shows that they would benefit from a different kind of treatment, rather than you carrying all of that in your head and having to remember, oh, there's new research, I should think about changing something up. This machine learning for workflow would nudge you and say, hey, think about this. It's not telling you what to do, it's just saying, think about this. The next big need that we have, of course, which we spent a lot of time talking about today, which is so exciting, there is such tremendous work being done, I'm just in awe of all the work that y'all are doing, is machine learning for diagnostics. So data visualization, tell me what's going on with my patient. Machine learning for workflow, help me understand what the next best thing for me to do is. Machine learning for diagnostics, help me make the best decision I can for my patient. But this next one I also really like to talk about, and this is multi-level modeling. So if we're not careful, in the future, we're going to end up with the same problem that we have today, which is a bunch of siloed data. only, instead of hunting and pecking through the chart for images and labs, we'll hunt and peck through the chart for what has my model told me to do, or what does my model recommend. And so this multi-level modeling system imagines a holistic system in which all of our models work together and are braided together in a way that really generates a seamless ability for the clinician to make the right decision for their patient at any moment. So I'm going to conclude with this slide. I know, only 2 slides. What's up with that? But one of the things that I think we get really stuck in healthcare right now is that we're still very much in a EHR mindset where we have a focus on this digitized patient record. It's a digitized version of the patient chart. And we really need to move to a EHS, an electronic health system mindset, where the tools that we use all work together seamlessly to optimize as much of the care delivery for the patient as possible. And so when we think about where this can fit in, so we've talked a little bit about patients and their caregivers today and how much opportunity there is to improve the patient and caregiver experience. Healthcare is complicated, and it is complicated particularly in oncology. And we have a lot of work left to do to make it easy to navigate for the patient. And I'm not just talking about returning reports to them, which I really appreciated Nick pointing out that earlier today from Epic. But even to the point where, okay, I have my information, what do I do with it? How do I expand my health span? How do I, as the patient, get to benefit from the machine learning insights that my clinician is benefiting from? And allowing access for the caregivers as well, because healthcare is a team sport, and that includes the team outside of the clinic. Clinicians, I planned to say this before everyone's said it, but we need to make it easy to do the right thing, because people are gonna do what's easy, right? We all know that. And the time constraints that staff across the board in healthcare experience are immense. They're gonna do what's easy, whether or not it's the right thing. And so creating systems that make that pathway the right thing to do, the easy thing to do, is of utmost importance. This operation component, this one's near and dear to my heart. So not only do we need to think about what happens in the interaction between the clinician and the patient, but we also need to think about the entire healthcare system. So when I think about opportunities in this space, it's things like, how do I automatically generate a staffing schedule that optimizes that optimizes a schedule based on infusion time, so that I can decrease empty chair time, so that my nurses and staff aren't overrun and my patient has the most efficient experience. And then finally, this last bucket here, which I will be the first to confess, I'm not a researcher, but what I do understand is that we need lots and lots of huge data in order to really accomplish what we want to in this next phase of research. And I am not just talking right now about the data that is mostly collected in the clinic, right, where it's a patient sitting in front of the clinician, and a clinician or nurse or someone is entering data. There's a whole host of data outside the clinic that we can really benefit from. You know, I think someone mentioned earlier, patient-reported outcomes, remote patient monitoring, remote patient therapeutics. And we have a tremendous opportunity to line up all of this data to really drive excellent insights for the future. And another thing that we're really thinking about when it comes to omics is, you know, sounds like a lot of y'all have worked with omic data, and it is big. Right? It is expensive and it is complicated. And so when we think about what we've been discussing internally is, how do we create a structure that allows the storage of that omic data, not only for insights for today, but that will allow the insights in the future, because we know that our tooling, we know that we're going to get more robust as we move on. So, I promised that I don't have a slide for this, but I promised that I would end with some of my big recommendations. And so one of my big recommendations, as we consider how do we really create an integrated system, an electronic health system, one is we need to deeply understand the needs of the clinician, the cognitive flows that happen at that point of care. Our data is siloed, our people are siloed, and we are committed to creating systems that eliminate those silos. And then the second is that we need to structure solutions with those cognitive flows in mind. So having a very sensitive eye on how all of our solutions are consumed. And with that, I will turn it over to the next speaker and answer all of your questions happily.